Every clinician knows this moment. You are in the middle of a busy shift, staring at an ECG or EKG, seeing something that might be subtle as ST elevation, and you are thinking, is this real or am I about just to overcall it? About 9 months ago, I started testing an AI ECG app called PMcardio to see if it could actually help in these gray zone cases. PMcardio is an AI-based ECG interpretation tool that's been evaluated in multiple published studies. It is CE marked in Europe as a Class IIb medical device. In the US, it has FDA Breakthrough Device Designation, but it is not FDA cleared for clinical decision making, which is an important distinction here. At a high level, PMcardio does much more than just STEMI detection. It provides automated analysis of rhythm, conduction abnormalities, and chamber hypertrophy, interval measurements like PR, QRS, and QTC, and interestingly, it screens for the likelihood of reduced left ventricular function based on ECG features only. This is really interesting and surprisingly accurate, estimating EF from EKG only, not from an echo. Quick disclosure before we go further, I reached out to PMcardio and was giving free access to the organization version of this app and the individual one, so I could test it thoroughly. I'm not being paid to make this video, and these are my independent impressions after months of use. Now let me show you here some example and put the app to the test. I prepared multiple EKGs with different diagnoses, and let's see if the app is going to be up to the task or not. Here is the interface initially where you log in, and this is the individual subscriptions. There is the home, reports, and the plus button where you add the new EKGs and upgrade, of course, if you want to upgrade to the paid version. This is allow you 5 EKGs per month. This is the one I have full access, which is the organization version. And as you see here, you have this bar at the bottom. We have all reports, right? Previous history, patients, if you add their patients numbers, STEMI alerts that you have in the history, and metrics. And here are the filters if you want to filter the patients here, and then the reports. Okay, the magic happens here is with the plus sign, and let's pick this EKG. I'm gonna save, and the magic will happen here. Let's see. All right, is there a clinical suspicion? So it detected something serious of acute kidney syndrome. I said yes, because I know this EKG is from a STEMI patients. STEMI, immediate invasive strategy. So this is the Queen of Hearts, give you STEMI or STEMI. And these are the heat maps that explain why it's saying STEMI. And as you see, it highlights the ST elevation in inferior leads and reciprocal depression in AVL, also ST depression in V2. Very interesting. And the LV sense tells you if there is decreased AF or not, which is really interesting. The rhythm here, sinus rhythm, the intervals, etc. But this was pretty obvious to me as STEMI. Okay, let's try to make it harder. Let's go to the photo library. Let's pick this one, for example. This is EKG showing the winter phenomenon, which is a STEMI equivalent and LAD occlusion. Let's give it save. Let's see what will it say. All right, is there a clinical suspicion of acute consumer? Let's say yes. Confirm. STEMI equivalent, immediate invasive strategy or equivalent management. Let's say it's trying to give me the heat map. All right, see the heat map. It's showing this upsloping ST segment with peak T wave. Very interesting. Inconclusive LVEF assessment, saying paced rhythm, and these are intervals. I'm not sure if it's paced rhythm. So it's been so far on the Queen of Hearts STEMI detection. It's been pretty accurate so far. Let's try another interesting one. I want to try this one. This is a Brugada syndrome. Let's see if it will say anything. It should not say STEMI or STEMI equivalent, but I don't know if it will tell me this is Brugada. No signs of STEMI equivalent. Reduced LVF detected. Interesting. Confirm with echo. Sinus rhythm. Non-specific intraventricular conduction delay in these intervals. I really hope I'm going to reach to them and see if these things they consider the future. It will be very helpful if you tell me this EKG is suspicious of Brugada syndrome. Let's try. I brought this one. This one has Mobitz type 2 AV block. Let's see what will it say. Of course, one of the interesting thing, even if you have a crappy EKG picture, the original is, look at the original, look at the digitalizing of the picture, much better and clearer. No sinus stem equivalent, mildly reduced LVF, sinus predicate, look, high grade, higher degree AV block, complete left bundle branch block. So it detected there is high grade AV block. It's call it high degree AV block. I think should call it high grade AV block, would be more appropriate in this case. Let's give it this one. This one I have, it's a pace rhythm, but look at the ST segment elevation. It's meeting Sgarbossa criteria. Let's see if it will detect it. All right, so there a clinical suspicion, say yes. And let me put no suspicion. Let's see what the message will be. No suspicion for ACS. Let's see what the message going to be. Signs of STEMI equivalent in a patient outside the intended patient population. Clinical review is recommended, and it's explaining why the heat map is on these V2, V4. I think it's focusing on the ST depression. Reduced LVF detected, pace rhythm. So all these intervals, interesting, really interesting. This one has WPW, mildly reduced LVF, no signs of STEMI detected, sinus Brady, bifascicular, so it didn't tell me. So I really hope that it tells me. So as you said, for detection, STEMI equivalent is great. It's really great. Although with Wellens, suspected Wellens, it didn't say it's Wellens or any suggestion of that. But when there is acute occlusion MI, even if the full STEMI criteria not met, it's very great. Sgarbossa criteria, D Winters, post-wall MI, it detects all of these findings very accurately. But I really hope it will, for example, if these findings suggestive of hyperkalemia, to say please check potassium immediately, or this is WPW, suggestive of that, or this is Brugada syndrome. Things like this I think will add much more value to the application. As you just saw, the app is great in detecting STEMIs or STEMI equivalent or subtle STEMIs or occlusion MI patterns before the full criteria of STEMI develops. This is great and help our argument with our cardiologists to speed up or activate the Cath lab even before the full STEMI criteria is met. But as you see, it doesn't really help, which I hope in the future does. Like, it doesn't recognize high risk feature like Brugada syndrome, or for example, it doesn't tell me check potassium. For example, I would like this if the app think this is related to hyperkalemia, to tell me check potassium is one of the differential, correct? And also didn't detect WPW. It didn't tell me there is a risk or a possibility of WPW. So these are the things that the app needs to work on. But overall, it's very helpful where it matters, when you need to make a decision now, when a decision within a minute can change the outcome of the patient, as in acute occlusion MI or high-grade AV conductions problems. Now, in the App Store, you will find two versions, one for individual use and one for organization use. The one for organization use is when your hospital or facility sign up to use it, so it can be integrated within your EMR and it can automatically screen EKGs, so it's very helpful. Now, the one you can find in the App Store is the one for the individual use. This one, it has a free tier with 5 ECGs per month, which is pretty limited, but you can upgrade for $30 per month or $300 annually for unlimited use. Again, the paid individual version allows unlimited ECGs and advanced features, and I've been using again both versions because I was giving a free access for both. So here is my final thought after 9 months of use. If you are reading EKGs, someone who reads EKGs a lot, like in emergency room or hospital medicine, right, where decisions matter, this app can be very helpful, especially in detecting subtle STEMIs, STEMI equivalents, or occlusion MI where the full pattern of STEMI has not been met yet. This strengthens our argument and discussion with our cardiologists trying to activate the Cath lab early. Also, it help us detect high-grade AV block as well, so we can hasten or speed up the treatment and management. And this is really helpful when you are in the middle of the night, very tired, concentration is not great, or you don't have support to someone to help you read the EKG. This app can be very handy and helpful in such cases. So my personal take, I highly recommend you get this EKG, whether the free version or whether the paid version or your facility have access. They gave you access for that is great. Remember, it's not FDA cleared yet. So use it to support your decision, not to make the decision for you. In the description field, I will leave a link for these apps, whether in the App Store or the Google Play Store. In the end, if you found this video useful, please give it a like, share it with your colleagues, and subscribe to the channel if you have not done so. Thanks for watching, and see you soon.